All right, welcome back to the Identity Woman podcast. I am Chantelle Branch, your self-love specialist, domestic violence advocate, author, speaker, and so many more things, like a wife and a mom of 4. And guess what? This is season 7, and I am so excited that you have decided to join us. And if you're new, welcome to the channel. Don't forget to like and subscribe. Share this with a friend. Listen to this in your car. Tell your sister, your mother, your uncle, your cousin, whoever. This year, this fall, I am making sure that I am connecting and giving us the content that we need to help our community. As you know, the Identity Woman podcast uncovers the denials and the realities of trauma to help women progress through their healing journey. And today, what other way to do that than with Dr. Chakika Williams. Dr. Kiki, thank you so much for being a part of the Identity Woman podcast. And today we're going to talk about the intersection of self-care and trauma. Dr. Kiki, who has such a great business that is so valuable to the African American community. Her goal is to make it a pillar, and it's already a pillar, and it's just going to continue to grow and ascend. Dr. Kiki, welcome to the Identity Woman podcast.
Thank you. Thank you for having me.
You tell us a little bit about your journey, how you became Dr. Kiki, and how you specialize in the mental and the emotional and the physical wellness of us, the woman.
Definitely. So I am a double-boarded nurse practitioner. So I am family as well as a psych mental health nurse practitioner, and the doctor comes from me having my doctorate degree. So my background is healthcare. I've been in the healthcare industry for 22 years. I've been a nurse about 15, MP6, and my business actually made 5 years old last month.
Congratulations.
Thank you. So the way we got into it is I've always known that I wanted to open up a private practice. And I wanted to have certain treatments for my clientele, such as Botox, because Botox treats a lot of medical indications. Most people hear Botox and they think just wrinkles, or they think of other nationalities that get it, but not realizing that it has a lot of other benefits. So me knowing that as a medical professional and wanting to incorporate that is what got me on the journey to being an entrepreneur or a business owner. And so in order to learn the medical side of Botox, I had to learn the aesthetic side of Botox. So the treatment for the fine lines and wrinkles, because that's considered a basic level, whereas the medical is considered to be an advanced level. So when I started learning the basic level, it was very intriguing, and it caught my attention to know that I can also not only help, smooth out the fine lines and the wrinkles, but it also helps to build confidence in a lot of women that are going through certain things that people don't know about or that they don't talk about. So yes, some people look at it as being vain or being superficial, but I actually make a difference in a lot of my clients' lives. Like I have clients that will sit in the chair and cry on their after photos because they haven't been able to step outside because of XYZ, or they haven't been feeling themselves because of something that they were dealing with. So it's not just about smoothing out lines, it's actually about changing the lives of the clients that sit in my chair. And so seeing all of that, I got deeper into it. So not only am I a provider of the services, I'm also an educator. I train nationally in all 50 states. So I fly to different states every other weekend, training other nurses and doctors to do what I do as well. So my focus is training other Black and brown providers to do what I do, because a lot of us are afraid to enter this industry because they feel like we don't belong, because we're undervalued, we're underrepresented, and we're overlooked often in this industry. I see it a lot. To this day, I've been training probably 3+ years, and I purposely come in the class at the very end when my assistant has done the introduction for the company, because I'm contracted with a bigger company outside of my academy. So I wait to the end. I may sit in the back just to kind of read the room, and the looks that I get, because they don't know who I am, of just being in the room. And the moment she introduces me or the rep introduces me, they look like, what is she finna teach us? Like, what is this little Black girl about to teach us about this particular industry? But by the end of the class, they're eating out the palm of my hands, because it's, oh my God, you're so knowledgeable. Oh, you know this. Oh, can I follow you? Oh, because you're judging a book by its cover. Because they don't feel like we belong in this industry. Yeah. And so I experience it firsthand almost every other weekend, because that's just how they've been brainwashed, that this is not an industry that's inclusive of everyone. Everyone see aesthetics, they see Botox, they see fillers, and they instantly think of different nationalities. They don't think of a Black or brown person getting the services and teaching the services.
Yeah, I mean, when I think of Botox, I think of a white woman. I think of a white woman in California on the beach. And maybe that's just the images that have been put out there in social media and on TV for decades, right?
Decades, yeah.
And so with your services, you are you're servicing people. You do Botox, you do fillers. What are some other services that you do offer?
On the outside of Botox and fillers, we're pretty much a one-stop shop for all things health, wellness, and beauty. So, and I like to say that because, as I mentioned, I'm a family nurse practitioner. So that means I can care for you on the primary care side. So I can be your primary care provider for diabetes, blood pressure, asthma, COPD, cholesterol, and so forth. And then we have the wellness and the beauty portion, which is we offer IV hydration services. We offer B12 shots, which is energy boosting. We do vitamin D shots. And that's huge right now in the season that we're in.
Yes.
We're in that winter season. And in the winter season comes SAD, which is an acronym for seasonal affective disorder.
Yeah, I'm kind of sad today. No. Because it's a little chilly out this Saturday.
And
I mean, it was like 85 last week, and I couldn't keep my hair straight, and it was so puffy. And I did a walk, and I was like, this hair is terrible. I'm just going to wash it and wear afro for a week. And I thought of the women that are in my community, and I thought of just different clients that I've had over the years. Because I never heard of SAD until maybe during the pandemic. That is when I actually heard of SAD. And so I wanted to talk a little bit about, the saying, black don't crack.
Yeah, but we bend and we fold a little bit.
Okay. So, I mean, is your clientele, do you have African American women coming in? Do you have men coming in?
I do. So
men getting a little bow tie.
Yeah, they do. They get I actually at this event yesterday, I had a bunch of men come up to the table, and the first question that I get is, what can I get? If I come to you can get everything that I offer.
Now, it's just facial?
We do facials, and under the facial umbrella, we do microneedling, chemical peels, dermaplaning, hydrofacial, so all of the facials. But men can get the facials. Men can get the Botox. Men get filler. You wouldn't believe it. But
fillers in their skin?
Yep. So fillers is areas. It's a treatment that we do to fill in and plump up a certain area. Maybe you have hollowing in your eyes. The under eye bags. We improve those with fillers. Men get that treated too. Men get their cheeks done. Maybe they're aging in their cheeks. Yeah, so everything that I offer, a man can get if that's what he chooses to do. We do not discriminate against anyone that wants the services, but I treat men and my clientele. I actually had to take a look. I used to think that my clientele was probably more of my Caucasian population. But when I was going through my photos and my content for my training classes, I actually noticed that my clientele is actually a lot of African American women.
Wow.
I have probably a 30% ratio, and majority of my clients are black and brown, honestly, that comes and get the toxin, Botox, the fillers, and then, of course, my weight loss program. So we do weight loss, IV hydration, body contouring, and then, of course, the facials. And then, as I mentioned, we do some primary care. And then I also do mental health. Because I'm a psych MP, I do the initial evaluations for my mental health clients, and then I refer them to the appropriate provider that's within my network.
Dr. Kiki is a triple, quadruple. She got it going on. And we will definitely make sure we plug in your information so that our listeners can connect with you and get filled up or Botox. And it's just so interesting that we're having this conversation because, like I said, I always thought of white women, and so you said that majority of your clientele is not is more African American women, and so are they? What's the ages that women are getting this or starting, or like a starting point, perhaps?
So it's like twofold. So they're actually starting as young as 21, and that's all nationalities.
But our skin is so good at 21.
We call it preventive tox. And so what it does is it prevents the formation of wrinkles. So when we're getting into our 30s and 40s. So my ideal clientele is 35 to 55. And so, but as you mentioned, Black Don't Crack, we may be 45 to 60 for my African American.
So we start cracking about 45, you saying?
For some.
Okay, so
but
lay off the sugar,
it depends on lifestyle too, because you can see someone and just like, man, they had a rough life, because you see it on their face. You see it in their face. You see it in their face. So they can be 30 and look 50 and be an African American. We don't. Not everybody get the special gene of not cracking early. So we have the solution. Yes, we have that fountain of youth for them if they need it, and so it's not something that because everyone always, when they do come, and I want to say everyone, they'll ask, well, what do I need? You don't need anything. What do you want me to do for you? I don't want anyone to ever think that they need or have to get any of my services.
So let's put a pin in that right there. What do I need? So they're coming to you, they're asking you, what do I need? What service do I need, right? I got the same thing. Did I get that in the beauty industry? No, they just was like, girl, this the picture, make me look like her. I'm like, girl, wait a minute, we need like 17 bundles before we can even book this appointment, right? But you said the person comes to you and they say, what do I need, right? And so they have already, in a sense, assessed themselves, and they have decided. So they looked in the mirror, they had all of these thoughts, they looked at themselves, they had all of these thoughts, and then comes the emotions that's attached to that. And then they decide, I'm going to put action behind this. I need to feel under my eyes. I don't need bigger lips, but they may say, I need lips, right? And so they go down this journey, they make this decision, and then they are led to your company. Like how important is it for them to come in and have a consultation with you?
It's extremely important because, for one, I need to know what I'm dealing with. Right? I need to know where you're at currently, what I'm assessing, what you tried. So anyone that's coming to us, we recommend a consultation as that first visit. If it's something simple like, I just want a B12 shot, I still do like a 15-minute consultation. But when it comes to my injectables,
you said a 12 shot, like 12 shot of what?
A B12. Oh, no. Okay. A B12. Yeah, so a B12
I don't know all the lingo. I know hair and makeup.
No, so a B12 shot is an energy boosting shot. Okay. But when it comes to the injectables, the Botox, the fillers, the fat dissolving, I do a comprehensive assessment because I need, for one, check your background, medical history, medications you're on. And so, as you mentioned, they are already at home tearing themselves up.
So, because I know people don't like to tell the truth, they lie. Yeah. So what happens if somebody, they come in, they have this great lie formed, right? And then you like looking through their whatever, are they submitting some parts of their medical records, or you're just asking, it's like a questionnaire,
subjective,
and they lying, they're not telling the truth. But like, what happens if you get into the room and you begin to do the service, and then their body has a reaction to it?
So I have a emergency kit for one. So depending on what type of emergency, we always have everything on hand that we need to combat any type of emergency, whether it's diabetes, maybe their sugar is low, they pass out. So we have that kit. However, in any area or any industry, we have consent that pretty much relieves us of any wrongdoing, because we're going off of what you're telling me. So
you filled out that questionnaire.
Yeah, you filled out that questionnaire. It's not as in depth as like a medical facility, where if you're coming as my patient, so we refer to the clients as clients in aesthetics. Medical side, you're my patient, so I can request your medical records from your other primary care provider, but I'm not seeing you as a primary care provider. You're coming to me as an aesthetic service, so facials, insurances don't cover that, so I don't necessarily have to request your medical records for you to get a facial. But if you're telling me you're not allergic to latex, you're telling me you're not allergic to this enzyme, and you filled that out, you filled it out, and you signed it. So that's all I have to go off of. So if you have a reaction to something that you told me you wasn't allergic to, that doesn't really fall on the provider, because we had you fill out this form. We had you complete it, and I have a question, honestly, at the end that says, I have completed this form in all honesty and blah, 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 to the best of my knowledge, and you said yes. So now if something happens, by all means, I'm going to do my job to make sure I can resolve it. But that doesn't fall like any type of legal issue on that provider, because we have them fill out those forms before we don't touch anyone that doesn't sign a consent. And if you go against our medical advice, actually, I don't know if you're familiar with it being in the hospital when a patient wants to leave and they're not really supposed to leave or ready to leave, the doctor makes them fill out something called an AMA, which is against medical advice form. And then once they sign that, they can walk out the door. And if they walk out the door and drop, it's not on the hospital anymore. So we have something similar. If you go against our medical recommendation for your treatment plan, I'll still do what you want me to do, but you signing this healthcare decision form that's saying that you want against what I'm recommending. So when you don't get the result that you want, you can't put it on me or my staff, because we recommended what we knew was the best thing to do to get you your result based on our experience, because we're the professionals, we're the experts that you came to see, but now you want to tell me how to do my job.
Well, that's social media. They learn it from social media. The mental of that. So she comes to you. She wants all of these things. But I heard you mention earlier that you deal also with the psyche a little bit. So if you notice this woman, maybe she's overly emotional. She comes to you. She wants to get all of these services done. How do you begin to work with a client like that? Because essentially, if they're coming to you, they already know that they in their mind they need something, whether it's true or not. And I think a lot of times, especially when we think about today and we think about different athletes or just different women in general who are influencers or celebrities, and they're online, and you see them how they started, and then like 2 or 3 years later, and not even that, it's like something's happening. Like soon as they get blown up or go viral, it's like, oh, I gotta get some teeth. Oh, I gotta go.
And the veneer.
Yeah, they go and they start doing all of these things to their body. No. How do you circumvent that, or how do you navigate that with your clients?
So for me, I have a plus because I'm psych as well. So a lot of people are, and I hate the word just, but a lot of people only have the aesthetic. They're just an aesthetic nurse injector, so they don't have the background of mental health and psych. So we always train that Botox cannot replace psychotherapy. Right?
One more time for the people.
Botox cannot replace psychotherapy.
And psychotherapy is
CBT.
CBT is
cognitive behavior therapy. Okay. So when you're dealing with mental health, depression, you're dealing with trauma, Botox can't treat any of that. We can't, I'm depressed, I'm having anxiety, or I'm having a bipolar situation, or I'm dealing with some form of trauma, whether it be racism, systemic racism, or generational wounds, or anything like that. You can't come in and say, give me 20 units of Botox and think you're going to be fulfilled with that.
So Botox is helping people with mental health? So
it is studies that actually shows that Botox does help with depression. And
girl, don't start nothing. People get down here.
But we don't market it that way because it's deeper than just in the company. And the reason that they say that it helps with depression is superficially, right? The vein is that when you look better, you feel better.
Oh, absolutely.
So that's what the study is kind of tying in. But the assessment, when you come to me, I'm doing a full consultation. And so we're going through everything, your medical history, your Botox and filler history, just everything, medications. And it's certain questions that is embedded in our assessment that it's like trick questions that they don't know. And it's how they answer those questions. And if they answer those questions where it raises a red flag for me, instead of me continuing this as an assessment for aesthetic, it has been converted over into psych and mental health evaluation because I have that background. So now I'm digging deeper to truly find out what's wrong with you. What's really going on? Because you're telling me this, but your face is showing me I'm asking you how you doing, and you got tears welling up in your face already.
Yeah.
So something deeper than that.
Something deeper than that. And not to cut you off, but then it's something deeper than that, right? And so she gets this service. And although she may smile and look happy and say, oh my God, you did amazing. She hugging people and talking to people at the front desk, and she's so friendly, and she leaves, and then she goes home, and then those emotions come back.
And so because I know of that, and I have the background to kind of deal with it in a sense, I don't start my consultations with what's wrong with you. I start my consultation with, tell me 3 things you love about yourself, because I want you to love yourself. Affirmations. I don't want you to come here and think I'm just the person that's going to fix all your problems. So I want you to know that I care about you as a whole person and not just the superficial side of you. So yes, they get the treatment, and yes, in that moment they're, beautiful, but we all know we got to go home and take that mask off, and we still got to deal with reality. So in that case, if I feel like it's really severe, then that's where my referrals are coming in at, to go and speak with a therapist, go and speak with, or even just advocating for, I had 2 clients today before coming here where I told them, like, we're going to be talking about the intersection of self-care and trauma, because one was like her job basically is eating her alive. They don't want her to call off. She called off. They made her feel bad. She put her phone on D&D and for the weekend, so to get a moment for herself, mental health. Yeah. And she wakes up to text saying, "Oh, that's not showing how you're a good team player." Because I took time for my mental. Yeah. And I could see it in her face that she was so. I say, well, if you don't take care of you, because she's on my weight loss program, if you're not taking care of you, and you're working the program that you pay for, you're not going to be here to help them, period. Nope. I say you have to put yourself first. So we have those conversations. I don't hold anything back with my clients. Yeah, you coming for facials, but we're going to do a session if we need to do a session. A new client, she came today. She went through, you talking about trauma? Last year, it was 4 deaths back to back. 2 grandparents, her mom, and a god sister, literally back to back. And she had to take on so much. So she lost herself in the midst of that. So absolutely. This year she's dedicating,
taking her time,
exactly,
back, taking her space.
So she came for weight loss, but we talking all types of how to take that time back. So it's not just all about coming to get a facial. You get everything from us. I can only speak for Sky Rose, but
no, and it's good. It was something that you said. You said that you still have to go home and take your mask off, right? Mm-hmm. And so one of the things that I always teach is addressing the woman in your mirror, right? So being a survivor and now a thriver after a domestic violence relationship, being able to still see my beauty every single day. And I did not... My mask was to put on makeup so I can go to downtown Chicago so that I can serve these women. Right. Mm-hmm. But then when I went home, I didn't even want to look at myself in the mirror to just remove the makeup. Right. But then it also got to the point when it was like to the end, like at the end, when I started just looking at myself and I could see my own pain, and it wasn't and I could just see my hurt. Right. And it was almost as if I could see myself aging. Right. And when we take off our mask, if you still can't see your own beauty, your how beautiful your nose is. I don't care if you got grandma nose or where your nose came from, which side of the family are mixed in. You got it. It's yours. You love on it. You go to sleep with it. You wake up with it. But it had to get to the point where I just had to begin to embrace who I was, right? And I was a woman standing in front of the mirror with bruises, and I always had a bloody lip, so I always wore red makeup. And I had to embrace that girl. I had to embrace her.
You have to.
And that was because if I didn't, I was going to keep avoiding her, and it was just going to keep me in that relationship longer, right? And it wasn't until I began to see myself with my mask off, looking at my face, looking at my life. Of course, what am I doing in the mirror? Replaying what I said, replaying what I did, replaying how I responded to what he did and what he said and how that aggravated him, and it just made it worse, right? And I'm playing all of this in my head, but it was that moment for me to stop and pause after the mask is off and say, hey, you girl,
what you gonna do?
What you it wasn't even what I was gonna do, because like every time I knew I should not be in this relationship, he is not the person for me. I need to make some. My biggest thing was financial. I need more money and support. Having people around you, your community, is so important for us to, when you remove that mask, to be able to, first you're vulnerable with yourself, but getting connected with people that got what you need. Like I love what you do, because it's not just giving her Botox, her treatments, and everything, and then you make your money, and you're like, okay, well, come on in, Sarah, your turn, right? And then okay, you do her, then you ushering in the next person, but you are literally taking the time to dissect some things that are in her brain that she doesn't even know she needs, right? And so being able to have that in your community is so important. That's why I really want to have you here as a guest. And that's why I do what I do as a domestic violence advocate. Because on the west side of Chicago, I didn't have anybody that was saying, hey, girl, you can go over here to this address and they'll help you if you're being abused. I didn't have that in my community. But being able to do not just services to enhance your beauty and make you better, but you also are at the same time having these conversations that are so needed to allow us to take that moment when we get home and we get in the mirror or we get in the car and we looking at our eyebrows and our lips and our, whatever, and we looking as beautiful as we are, to pay attention to what is deeper inside. Because again, I can do your hair, your makeup, you go to her, she gonna do all the other stuff y'all need. And then you're gonna walk out, right? You're gonna go on this red carpet, you're gonna be so glamorous, but at the end of the night, you're not even having your best night. Home. You're not even having your greatest night, because in your head, you're like, I ain't even pretty enough. So,
and that falls, that statement right there, I'm not pretty enough, is one of the statements or the things that we look for in our assessment that lets us know if they're on borderline BDD. And BDD is body dysmorphic disorder. BDD, not BBL. BDD. Wait, BD. Yeah. B as in boy, D as in dog, D as in Delta. Yep. Okay. And so, and that disorder is huge in our industry, because you mentioned social media, you mentioned celebrities, you mentioned influencers, and so you have these younger girls, or even the ones that are 20s and 30s, that is watching all of this, and they're comparing themselves to that person, thinking that they are not pretty enough. Or I'll even go even deeper, as a dark-skinned Black girl, that we're not pretty enough. It matches up to our lighter complexion counterparts. So it's like you have that in your head, that or even the comments, the backhanded comments that us as dark-skinned women get. Oh, you're pretty to be dark-skinned.
That is,
and what does that mean?
That don't even make sense to me.
It don't. And someone said that to me a few weeks ago, and I'm like, that's not a compliment. And he got mad, and we was at our little class reunion or whatever, and he's like, well, I said, that's not a compliment. I say, what you want me to do? Shake your hand?
Give you a hug? Oh, so good to see you. Thanks.
I'm like, what does that even mean? And the other girl that was saying, she's like, girl, I'm not hearing something. She's like, I hate that stuff too, or whatever. But it's like, what does that mean that I'm cute, I'm beautiful to be dark? So if I wasn't dark or whatever, so it's like you have those statements, you have the celebrities you're looking at, and you're comparing yourself to those celebrities, thinking that you're not good enough. And so, like you say, you're pretty, you're looking at this and that, but then you still have that voice, right? So some of the questions that we look for in our assessment is, I want to be perfect. I want my face symmetrical. Those are red flags that this person is borderline BDD. So now I'm really digging into my assessment with you, because you're saying things that pretty much is a sign that it's more mental than it is superficial for me. So now I need to really understand what's going on with you and guide you in the right direction. And then we have the ones that, those are more overt symptoms. Then we have the ones that walk in the door, and when they walk in the door, you're like, what you want me to do? Because you're overfilled.
Wait a minute. So there's a celebrity out there right now, and she is trending heavily. And she's such a beautiful woman, right? We grew up with her. She's a legend, and I want to understand when, like, how do you? I guess for you, how would a client know that too much is too much? Or say you have a woman, for instance, when we look at Serena Williams, who has had a lot of services and treatments, how would you, if you had a client that was similar, or a new client that came in, how would you assess that person?
So one thing we have to do, and I apply this to any industry, any professional, we have to get comfortable having uncomfortable conversations with people. So we have to be transparent, and we cannot be afraid to tell them the truth, because that's why they're in the situation that they're in now and looking how they look, because the previous injector didn't tell them no, or didn't want to hurt their feelings. And so we have to basically be comfortable to tell them, like, hey, I know you came here for XYZ, but as an expert, as a professional, my professional opinion, or whatever the case, I honestly think we need to start here, and I will recommend that you dissolve, because it's certain things we point out on their face. So if they're overfilled, sometimes it's going to be really translucent, because the filler is what we use for filling in things. So in the cheek area, if it migrates, and migration just means it went from where you put it to somewhere you didn't want it, it's sitting here like right up under the skin, so it's very translucent, and it almost looks like if you wanted to put a goldfish in there, you'll see it swimming. That's how translucent it be. Wow. Point that out to that person, because they may think that that's what it's supposed to look like. Like, you see this, it shouldn't look like that. This is what it should look like. Now you have your before and afters, and you're showing them like how it should look compared to what theirs is looking like, and just being honest with them. Honesty goes a long way. I had a elder client, she was like 7 in one of my trainings, right? She came in, and when you're 55 and above, depending on the laxity of your skin, how loose your skin is, descending downward, you're really not a candidate for anything that we do with Botox and fillers. You're a facelift candidate, meaning that I need to refer you to a plastic surgeon. You need to tell that person that. And some people are like, well, I don't want to hurt their feelings. I don't want to tell them that they need plastic surgery. Why not? Wow. They came to you for a professional opinion. And my professional opinion is how you say it. It's not what you say, but how you say it. And I told her, I say, well, you know what, based on science, when you are 55 to 60, depending on how...
Yeah, so we need to get all these treatments before 55 BC, because after that, it's a mess.
And so she was... Although I told her she needed a plastic surgeon referral...
At 70?
If she wanted to.
Okay, you're right. It's your choice.
It's your choice. But this is what I'm recommending as the professional, because if I try to treat you with what I have non-surgical, do you know how much product I would need to get you to lift? And now you're going to look like overfilled. So I told her, you're going to potentially need probably a facelift.
Wow.
She's like, wow. She's like, no one has never
told me that. She said, wow, too.
She's like, no one's never told me that. She's like, thank you so much. Like, she was because no one told her. Now she's going to go and do it. But now she knows that any treatment she gets that's non-surgical is not going to get her to take that 20 years off that she's hoping for, because it's just not doable. It's
so
not.
Are you saying your services take 20 years off?
They can take about 5 to 10.
5 to 10. Well, okay. I've learned a lot. I should have went into ST. No, just kidding. Just kidding. And so, what is your mission? What is your goal right now today, as Dr. Kiki?
So my goal, as I mentioned, with that one-stop shop. So I want to continue to be that for all things health, wellness, and beauty. But I want to also present myself as this Black and brown provider and educator to other Black and brown providers and clients, to know that it is okay on the client side to receive these services and not feel ashamed of the things you want to do to help improve whatever it is you're trying to improve. And for the professionals that's wanting to get into this industry, being that person that basically push my hand back and lead them in. You know, we have so many gatekeepers. We have so many crabs in a barrel mindset that we get into a position and we don't want anybody else to come. And that's not my goal. My goal is to bring as many people into this industry as I possibly can. We do have a nonprofit where we're going to be starting to actually start mentoring younger girls that wants to get into the aesthetic industry, or even nurses that want to get into it and maybe they don't have the funds to truly apply towards the investment that's needed, but we can provide them with the knowledge base and the education and the shadowing opportunities to just kind of be in that area, in that environment. As you mentioned, being around the right people. You got to be around the right community. So being that that community for the people that want to be in this industry, and just kind of being that refuge where our clients can come, and that not only are they going to get a nice facial, but they may get a therapy session too.
Oh, free therapy. No, it ain't free. Because these services are real. So tell us, I would say we're about to wrap up. So tell us, no, that's not it. That's the second one. What do I want to say? What is your one statement to African American women who are thinking about getting this service. She has not yet pulled the trigger. She's been doing research. What would you say to her as it relates to perhaps if she already has some trauma and being able to incorporate this this service of self-care and also the benefits like yeah, all of that good stuff.
So, I mean, trauma kind of it disconnects us, right, from who we are. So when you are dealing with your trauma, trauma can affect a lot of things: your health, your skin, weight, mental, and so you're disconnected a lot from a lot of things within yourself. So when you incorporate the self-care portion, we're pretty much helping you to reconnect all of those portions. So it's extremely important. It's a priority that you don't want to just be surviving, but you actually want to take that initiative to actually be present. And so when you're taking the time to get back to you and you're incorporating these self-care measures, and self-care doesn't always have to be coming to do an actual service, reading a book. I met a young lady. She has this little door tag you can put on your door that says mommy me time, so basically don't come knocking.
I use that, guys. It works. You just have to keep your boundaries up, especially if you have little ones, because the baby's so cute. Mm-hmm. But tell that little baby no.
But yes, so just incorporating what we do offer is just going to help that person to start reconnecting themselves from the trauma that disconnected them in the first place. So that's coming, and we we make our environment that luxury, relaxing oasis where when you're there, it's about you, your priority. So we're there to basically make you feel whatever it is you need to feel from us to be able to go and leave, and not just leave and it just be temporary, but something that you're going to continue to incorporate. You leave with a lot of different nuggets and pearls to incorporate into your lifestyle to deal with whatever you're dealing with, whether it be mental trauma, physical trauma, emotional trauma. I try to, because I relate to a lot, so I try to make sure that I'm always giving my clients something extra than what they came to pay for in the first place.
Well, thank you. I want to thank you so much, Dr. Kiki, for being a guest on for being a guest on the Identity Woman podcast. And I want you to look right there in the camera and tell us how we can find you and how we can get our services. If you need lips, you need cheeks, hydration, you need vitamin D because, the winter is coming and, the brown girls, we need vitamin D.
And not only that, the low vitamin D level mimics depression.
See, you got a shot? Where to get my shot at?
Yeah, it mimics depression.
Now, if we get a shot of vitamin D or we take
a shot, an actual shot.
Oh, okay.
Yep.
Well, how many of those little vitamin D pills we got to take every day?
If you're taking it daily, they have the 2,000 micrograms. But if you take it weekly, you can do a 50,000 international unit, or you can get the 50,000 shot.
Now, does it make you feel funny?
Mm-mm.
Okay.
Because it's vitamins, but it's definitely...
sometimes you take that one day woman's vitamin and you be like...
fancy.
Yeah.
No, it doesn't, but it's important because you may think you're depressed and it's probably just a low vitamin D level.
See, I'm not depressed. I haven't... No, I'm just kidding.
But yes, you can find us on Instagram at SkyRoseRCS or at _aestheticpreneur. Those are our Instagram pages. Facebook is also Sky Rose Rejuvenation Clinic and Spa. Our website is www.skyrose, SKYROSE, R as in Robert, C as in Charlie, S as in Sam.org. You can also book from that website your consultation, or you can contact us at 708-966-4258. And we have a YouTube page too, Sky Rose RCS.
Well, this has been an amazing interview. I learned a lot. And Dr. Kiki, she changing one face at a time.
I am. All faces are not created equal.
That's right. That's right. So don't come to her office talking about you want to look like so-and-so, so-and-so, so-and-so. She going to give you she going to help you enhance what God gave you. Okay? Well, thank you so much. This has been so good.
I appreciate it.